McDonald's is pulling its popular Quarter Pounders off the menu in 10 states due to a deadly E. coli outbreak. The CDC says the burgers have been connected to more than 4 dozen infections. At least one person has died and several remain hospitalized. More than half of those infections were reported in Colorado. Joining us now is Darin Detwiler. He's a professor at Northeastern University and a food safety advisor who's written multiple books on the subject. So, Darin, McDonald's says it's linked a subset of cases to slivered onions, but hamburger patties are also being investigated now. Talk to us about how E. coli contaminations like this one actually happen.
Well, first off, E. coli is found in the intestines of cattle, and it usually in the intestines is surrounded by either the meat or the hide. And so if there's cross-contamination there at slaughter, this is where we get E. coli into the product. If we're talking about produce, what we've seen, especially when you look at lettuce or other produce, is that it's contamination from downstream of the cattle operations. So when you have E. coli in food, essentially the only kind of proper kill step is that of cooking. And whereas we can cook the hamburger patties, in fact, McDonald's had an outbreak of E. coli back in the 80s, and they instituted incredibly effective policies and procedures and technologies to make sure their hamburger patties were cooked well enough and long enough to the right temperature to be an effective kill step. But, most people don't want their lettuce, tomato, pickle, and onions on a hamburger to be cooked. So you don't have the ability to cook and kill that pathogen for those items. So it takes testing and auditing and validation that would take place much earlier in the cycle to prevent contaminated ingredients such as these fresh produce items to even get to the facilities and franchises.
Well, and there's a question that we're hearing from folks. They want to know if there's any way to know if their food's contaminated with E. coli.
No, it is not visible. You cannot see it or smell it or taste it. The only way to tell if it's contaminated is through testing. And, testing takes a little while for results to come back. That's why it's imperative that companies are testing frequently, they're testing early, and they're testing these products as effectively as they can, not just resting solely on the assumptions or the reputation of their suppliers. So it sounds like this may be from a single supplier that supplied those ingredients within that region. There'll be some investigations into determining is that actually the source and what caused this to take place in the first place.
And people also want to know about the symptoms and the concerns that are associated with an infection. How long before symptoms start to develop after coming into contact with E. coli?
It really varies. A lot of times it varies on the age or the status of the immune system of the consumer who gets sick. While there's no one perfect number to give you, the more vulnerable victims, those who are very young or elderly, those with a compromised immune system or who are pregnant, are the ones who usually show the symptoms first or have enough symptoms such that it persists long enough that they want to seek medical attention. Obviously, in this case, the one gentleman from Colorado who died is elderly, but in many cases, we typically see that it is, again, the very young and the elderly and those who are pregnant or with a compromised immune system that show symptoms early. Those symptoms are everything from nausea to bloody diarrhea to, if it gets worse, the idea of a decrease in renal output. You're not urinating enough. There are a variety of symptoms. They differ between pathogen and from person to person. But if you feel as if you have a stomach flu or a stomach bug or it was quote unquote something you ate, most people don't do this, but you should see your doctor. You should get tested and see if it is something that needs to have medical attention. Also, the idea of being able to collect that information in terms of where did you eat, what is the source of this, because if it's part of a bigger outbreak like we see in this case, it will help investigators and health officials try to make sure they can adequately and quickly determine the point and bring an end to an outbreak such that we decrease the number of potential liabilities and minimize the harm on consumers within our communities.
All right, Darin Detwiler, thank you.